Hi everyone, this is Colin Murphy, and today I'm going to present my findings from my informational interview of a public health professional. So the person I interviewed was Rich Baker. He works for Victory Programs in Boston. His role is the Mobile Team Program Director for Victory Programs. He first gained an interest in public health by working in the Peace Corps. He spent 2 years in Tahiti, where he worked on environmental health, helping villages get access to clean water, among other things. And so when he returned to the United States, he wanted to continue his work in the area of public health. So that's when he started at Victory Programs in 2016. And while he was working, he also completed his Master's of Public Health at Boston University. So between the Peace Corps and his experience at Victory Programs, he has about 7 years of combined experience in the public health field. The mission statement of Victory Programs is as follows. Victory Programs opens doors to recovery, hope, and community to individuals and families facing homelessness, drug and alcohol addiction, and chronic illnesses like HIV and AIDS. So as far as the programs that they offer, they have a variety of categories, beginning with their health programs, which provide individuals coping with substance use, hepatitis C, HIV, AIDS, and co-occurring mental health issues by providing them with education, tools, and ongoing support that they need to help regain health, prevent and manage a relapse, and maximize their independence. They also have housing programs that provide housing stabilization services that help move those who are homeless into permanent housing. They have supportive, individualized residential treatment programs that enable individuals to stabilize their lives and regain their health, continue recovery efforts, and move towards complete self-sufficiency. And then the area that really includes the work that Rich does is in their prevention programs, which was created in 2015. It includes the Boston Living Center and the Mobile Prevention Team. Again, that's where Rich works. So they have different areas, one called Positive Prevention, which focuses on education and services for members of the HIV positive community. They have Primary Prevention, which is education and sexual health services for the community, and drug user health. So things like overdose education, harm reduction, and naltrexone distribution, which naltrexone is a drug used to reverse an overdose. So I think prevention programs is really crucial to what we've learned in this class, because it's much more of an upstream approach, providing education and preventing disease before it happens. As far as the public health services that are linked to Victory Programs, in my opinion, I think those are Monitor Health, because they have services for those who are already HIV or hepatitis C positive, Inform, Educate, Empower, again, going back to that kind of prevention services that they offer, and also for those who are HIV positive, how to best manage their illness so that they can go on to lead long, happy lives. Link to and provide care, again, for those who are at risk, as well as those who are already infected with a particular disease. And also assure a competent workforce. Obviously they employ people who are professionals in the public health field, like Rich. So those are the essential health services. My key takeaways, it was a great conversation we had, but two things that he said to me in particular really struck out. One of which was be motivated and do what you want to do. You cannot choose this work on the basis of compensation alone. The emotional toll is demanding, and the work requires a degree of understanding and humbleness. I think that a lot of us got into this field looking to make an impact, looking to make a difference, not particularly for the money, and that was sort of backed up by Rich. And he also said it can be challenging to be outcome driven when working often with people who are in very complicated situations that prevent them from reaching the success metrics. Obviously, when you're dealing with a complexity of issues such as homelessness in combination with HIV, AIDS, there's a lot of moving pieces and parts. And he said, the work is challenging, but very rewarding. And here are my references from today's presentation, and I hope you enjoy, and I look forward to the discussion.